thanks to all of you for being here. We couldn't have a conference unless you would be here. I'm going to share with you some things about some of the patients that I've seen that have to do with brain death. But one of the significant things about the patients I'm going to share with you is that they had someone who cared, someone who stood up for them. And so while you're here to become, have greater knowledge and information about this subject, you should know how important you are, how important you are to yourself, to your family, to your friends, and how important it is for you to understand these things better and then to go forward. Because remember, every one of these patients that I'm going to share with you had someone who cared a little bit more. And of course, they were able to continue to live because they had a doctor in some way or another that participated. So it's very important for the person to care. It's very important to have a doctor who cares. TK has been mentioned. TK was my patient, and I was not the one that had the primary treatment of him, but I consulted on him and covered for him for his care. And at one point, the nurse called and said that that his blood pressure was going down. So I went over to the hospital, and his mother was sitting on a chair next to TK. TK was in the hospital bed on a ventilator. And I said to her, I said, Renee, Todd's blood pressure is going down. Do you want me to do anything about it? Remember, at that time, he had already been declared brain dead at least 2 weeks before that. And she looked up at me and said, well, what can you do? And I said, well, we have medications that we give, and sometimes the blood pressure will come up, and sometimes I respond to that. I can't tell you for sure what will happen if we give it to him. And she looked up at me and she said, well, get on with it. So I gave him his medicine for his blood pressure. He was on, and his blood pressure came up, and he was on it for only a few days. And then he was able to be weaned from the blood pressure, and he lived almost 20 years after that. And so this thing about how they die quickly because they don't get treated, or they die quickly because they get their organs removed. In any event, that's Joseph. And Joseph was born in 1975, very prematurely, and his mother insisted that he could not have been any more than 20 weeks. Joseph's mother, by the way, is 6'3", so when I talked to her, it was eyeball to eyeball, and Joseph's father was 6'8". Now, I don't know that that has anything very much to do with it, but many times the limiting factor in survival of small babies and premature babies, while you hear things about weeks and you hear things about weight, the real limiting factor is the size of their trachea, because the smallest endotracheal tube that we can use is 2.5 millimeters. Now, why is that such? Because you have to be able to put another tube down to suction and clear that airway. And you see, as you get smaller, the first thing you know, there's no more space, so you can't suction. So Joseph survived, and I'll tell you more about him. But why? I sometimes think maybe it had to do with his mother and father, who were of good size, and maybe his trachea was a bit bigger. But in any event, that's a photograph of Joseph. You can see he's very tiny. That tape that's there holding the endotracheal tube in, that tape is a half an inch. And so that gives you some idea about what size he was. When Joseph was about 5 weeks after he was born, and he was still on the ventilator, and he wouldn't move, and he wouldn't do anything, and one of the doctors on rounds said, let's do an EEG. So we did an EEG, that's a brainwave recording, and it was essentially interpreted as flat, and then the words consistent with cerebral death are written on Joseph's chart. And so I read that and read death, and I looked at Joseph and I said, what's this all about? So I called a neurologist, and he said, well, don't be concerned about that, just get another one. So we did 2 days later, and it was unchanged from the previous one. So I said, well, what do we do now? And he said, well, some places they turn off the ventilator. I said, well, I don't do that. Incidentally, I've treated many, many, many patients on ventilators over the years, and I've never turned off a ventilator. You don't have to turn ventilators off. You just have to use them, because the ventilator will only work when the patient is living, and patients do die on ventilators. But in any event, we continue to treat Joseph. Joseph was able to get off the ventilator. Joseph was able to be discharged from the hospital. And there's Joseph when he was 7, riding his bicycle. And there's Joseph married, and that's 2 of their children at that time, and they had another child after that. So you see what happens when someone has things like flat brain waves. If you continue to treat them, they continue to live and do things with their subsequent life. Now, I want to share with you some things about Jahi McMath. A lot of you read about her, heard about her. Jahi McMath was a 13-year-old girl in Oakland, California, who had tonsil surgery, and post-op with the tonsil surgery, she had hemorrhage, and that hemorrhage got involved with obstructing her airway. She had lack of oxygen, and was said to be brain dead. How did I get involved with her? Her mother was on the television and pleading for someone to help. One of my sons was there. It was Christmas time, and he was there, and he poked me and said, "Well, Dad, what are you going to do?" So I called the airlines and got a plane ticket to go to Oakland, California. And they wouldn't let any doctors in to see her. So how did I get in? I went in the middle of the night, and the guard was there, and her stepfather came down, and when he was 10 or 15 feet on the other side of the guard, and I was on the other side, he said, "Oh, Pastor, come on in here." So that's how I got in. So what did we do? I met with the. I saw Jahi, and then I met with her mother, her grandmother, her stepfather, and other members of the family. And I said, now there are some things that can be done to help Jahi. I said, but you have to know, I am not licensed to practice in the state of California, so I can't be a practicing physician. And so I said, I can tell you some things to do, and if you do them, why, it might be helpful. But in any event, we did manage to get some treatment started on her right there when she was in California. They despised Jahi. The hospital and the hospital people despised her. They would not call her by name. They called her a dead body. They wouldn't give her any nutrition. She had no nutrition for 3 weeks. This is one of the a very awful time for her, for her family, and so before I saw her, 3 days after she had the tonsil surgery, she had a death certificate issued on her. And I did everything I could to find a doctor or a hospital who would take her. And I mean, I called every place you can think of. I was working a long time. Some other doctors got involved. And those other doctors found a hospital in New Jersey who would take her. To get Jahi out of the hospital, we got her out in the middle of the night, and the hospital where she was, they wouldn't even allow a sheet to go with her. They despised her so much. And the only way we could get her out of New Jersey is that the mother had to agree that she was dead. And then the mother had to agree that and be participating in transporting a dead body, and had to agree that they would do everything to get her back. But the coroner had already issued the death certificate on her. When they went to, the mother had to go and record her death, and the man who recorded said, "This is the first time we ever recorded death on somebody that was still in the hospital with a beating heart and circulation and the like." In any event, we did get her to New Jersey. New Jersey it's significant because New Jersey is the only state that has in the statute in the laws in New Jersey that if someone has a beating heart and circulation and the family does not accept that their relative is dead, then they can't call them dead. It's a conscience protecting thing. New Jersey is the only state that has that law. New York has it, but it's in the rules and regulations. So those are the only two states. New York is not quite as strong and firm as New Jersey. But in a little bit, I'll tell you about another patient, so that even though I say it's strong and the conscience clause is there, it doesn't really do too much because of different things that happen. But in any event, she was transferred from California to New Jersey. In the hospital in New Jersey, they did a tracheostomy and they put in a PEG tube, but they would give her no treatment. It was so sad. She was in the hospital for 9 months. They didn't do one EEG. They didn't do one CAT scan. They didn't do one MRI. They would do nothing. The way that we had to treat her was had to go to health food stores and other things, and had to figure out how to get different treatments into her, which her mother had to do. She was there in the hospital for 9 months and then got transferred out of the hospital. And so then she was at home, and then after she was at home, I did everything I could to find a pediatrician who would take care of her. I could not find a pediatrician in New Jersey who would take care of her. So who took care of her? Dr. Alieta Eck took care of her, and she's a wonderful doctor. Dr. Eck helped tremendously at treating Jahi. And Jahi was at home. Later, after she was home, Dr. Schumann got involved and was very helpful and did a number of things. And even though she had the death certificate in California, and even though she had 3 neurologists who said she fulfilled the brain death criteria, and even though she had a technetium scan of her brain which showed no evidence of circulation, all of that in California, after she was in New Jersey. And incidentally, her treatment that we got started was thyroid. Thyroid hormone is so so important for the maintenance and healing of the circulatory system and the heart and the brain and the respiratory centers in the brain. And so a thyroid was started, other nutritional things, and then when I went to see her, and Dr. Schumann went to see her, her mother would say, "Jahi, give me a thumbs up," and it would take a little bit, and then her thumb would come up. Jahi, raise your left leg, and it'd take a little bit, and then left leg would come up. And so what then happened is that it got involved in the court system, and as far as I know, it's still in the court system. Remember, she has a death certificate in California, and then she lived in New Jersey for more than 4 years, and then she has another death certificate in New Jersey. And so what is this all about? In California, there is a limit to liability, so that if there's death of a patient in California, the limit to liability is $250,000. And so if they can make that happen, then somebody only has to pay $250,000. If she's alive, then the liability is millions of dollars. And so ultimately, that's what this really comes down to, is dollars. And yes, thank God for Dr. Schumann, because he got involved and was very helpful and got other neurologists to also participate and that kind of thing. So there are at least 3 neurologists that examined her and said that she's alive. Now, there's a photograph when I was there. Obviously, that's Jahi's hand. That's my hand. Part of why I took that photograph is because you can see her mother took very good care of her hands, like a teenage girl, fingernails look nice and that. Well, when they published pictures of Jahi, the if you want to call it skeptic, says, "Well, how do we know that's Jahi's hand?" So I had my picture taken, and that's my hand. Incidentally, you see this bracelet, it says Jahi is alive. I have one on there too. I meant to bring it, but I didn't bring it. But it says Jahi is alive, and on the other side it says prayer works. Her mother said, "That's what you told us when you came to California." Now, I want to back up 1 second here, because I want to introduce the next patient I want to tell you about is Takisha McKitty. Takisha McKitty is a 28-year-old young lady who overdosed. Incidentally, the overdose is important because in the United States, they get more organs from overdose of drugs than they do from accidents and gunshot wounds combined. And it's become a way of getting organs. And sometimes what happens is, as Takisha was on treatment, and then sometimes they fall back, and then the drugs that they take oftentimes have a greater effect than what they did before. Whether all that happened with Takisha, I can't tell you, but I can tell you that when she was admitted to the hospital after the overdose, she moved and she did things, but very quickly they said that Takisha was brain dead. And so they contacted me, and I went to Canada to see her, and I was just excuse me, show you some recordings of Takisha and that her father made, and these are just some of them. And remember, Takisha has already had a determination of brain death for weeks before these things, maybe months before these recordings were made. So her father made these. You remember, she's brain dead. You see her feet moving. See her feet moving. her father stimulating her. It takes a while, and remember, she's brain dead. She's brain dead. She would have already had her organs taken out if it hadn't been for her father.
Now, the government is under deadline. The top priority at the birth center right now to get the organs integrated, because if they do not do it by mid-November, then it's actually breaking the law. Right. So people don't want to get it.
So you see, that was recording of Takisha. You see all of her movements. You see her body move, her head move. You have to know she was deficient in thyroid also, but they wouldn't give her thyroid. But then they started thinking, well, maybe they're going to be able to get her organs. So then they did give her some thyroid, and so she got thyroid for that reason, and not in the same dose that I wished that she would have gotten, and she didn't get testing like we ordinarily do when we give thyroid to patients to determine if it's enough in that. But I really think it had something to do with helping her to live longer. Takisha had the declaration of brain death in September, and she lived more than 1 year, about 14 months until she died on New Year's Eve. But they refused to give her thyroid. They refused to do a tracheostomy. They refused to do a peg tube. If they would have given her thyroid, it certainly would have, in adequate doses, it would have helped her. If they would have given her a tracheostomy, the tracheostomy, once a patient is on a ventilator with an endotracheal tube for about 2 weeks, there's some patients that you can get by a little bit longer, but almost always you have to do tracheostomy. And the tracheostomy not only makes it so they can, it saves their life, but it gets them off the ventilator, and then they can get out of the acute care hospital, and they can even go home, but they wouldn't do that. The PEG tube is a feeding tube that's put through the abdominal wall. We live in modern times. I have to tell you that when I started to practice medicine, the feeding tubes were only rubber. And they didn't tolerate them for very long. And then plastic was invented, and then the plastics were invented, and then they kept getting bigger, better and better. So the PEG tube can get put in very easily. They actually use a scope and go down through the esophagus. They can use local anesthetic, and then with the scope, it shines a light through the abdominal wall, and it shows where to make the incision to put the tube in with local anesthetic there. Sometimes it takes like 20 minutes. I have some patients that are at home and they need to get the PEG tube, and they go and they get it as an outpatient. It's that kind of a procedure that's relatively simple to do. Tracheostomy can be done at the bedside in their room. They don't have to go to operating room or anything like that to get it. So they refused tracheostomy, refused PEG tube, refused adequate doses of thyroid, refused. We documented, because of the test that they did, that she was very low in vitamin D. They would not give her vitamin D, those kind of things. And if she'd have gotten those, she could have gotten out of the hospital and certainly gotten out of the acute care hospital. I want to tell you about Israel Stinson. And I'm just telling you about some of the patients that I see with these conditions. Israel Stinson is a beautiful little boy. He had a little sister who was also beautiful. And Israel Stinson had acute asthma attack. And he was fine before that, acute asthma attack. In the course of that gets involved as to one hospital, the other hospital, and he had a cardiorespiratory arrest and did not get treated right away, and got declared brain dead. And that he was also in California. So I went to California to see him. We did determine that he was hypothyroid. He needed thyroid medication. He needed a tracheostomy. He needed a PEG tube. I could not get anyone in the United States to do these things. We couldn't do it. What happens is whenever we would get a doctor or hospital who was interested, then the treating doctor would talk to the potentially receiving doctor, and after that conversation, nothing happens. They always fall apart, and ultimately, some of that boils down as to who pays, and that kind of thing gets involved. But we couldn't get anybody. And so then what do we do? We transferred Israel Stinson to Guatemala. When he got to Guatemala, they did the tracheostomy and they put in the PEG tube, gave him his thyroid and his medication that he needed, and gave him good nutrition. He was in Guatemala for about 4 months and was doing well there. We could not get any hospital or doctor in the United States to take him back. And actually at that point I said, well, I'll just bring him to my home. And then in the course of that conversation, 3 of my daughters got me in my kitchen and said, Dad, you can't do that. And of course I paid attention to them, but I was thinking, you don't know all the things I've done in my life that people told me I couldn't do. But in any event, to make that part of it as brief as possible, what then happened is we kept trying to still find a place for her to go. So the hospital in California, Los Angeles Children's Hospital, said they would take her. So we thought that was great that they would take her. So they did take her back. And she was there about 2 weeks, and in that process, they, between the doctors and the legal system, they took away her treatment, and they get the mother and the father off in another room and take away the ventilatory support, and then he died. Ari Chakrabarti, Ari, 14-year-old boy with autism. He lived in New Jersey, and the house caught on fire. And for whatever reason, nobody really knows, he was out of the house and then he went back in. One can postulate why a 14-year-old boy would go back in to get his laptop computer or whatever it was, but he didn't come out. The firemen had to go in and bring him out. He was in New Jersey, and remember, this is significant because New Jersey has that conscience clause that would have protected his life, but they transferred him to Philadelphia Children's Hospital to get better treatment and care for him. And there at Philadelphia Children's Hospital, in a relatively short time, they declared him brain dead. And so I went to Philadelphia to help, and he needed a tracheostomy. It could have been very easily done at that hospital. The father advertised. He offered $100,000 to any doctor who would do the tracheostomy, and no doctor in the United States that we could find would do it. So he needed the tracheostomy, he needed a peg tube, and so he went to Guatemala also. You got to know the doctors in Guatemala. In some ways, they're kind of like I was as a doctor when we started to the field of neonatology. We looked at all patients as living patients, even though we didn't know what to do. We tried and that kind of thing. The doctors said they took these patients, took Ari. It was different. They were different doctors. It was two different hospitals. Both of them took excellent care of the patients, did the tracheostomy and the peg tube and the thyroid in adequate dosage, and Ari was doing well, but we couldn't get anybody to take him back. So what did his father and mother do? They put him on the airplane and flew him to New Jersey. And now he's in the lands in New Jersey and taken to the emergency room at Children's Hospital in New Jersey. And they first they didn't even really want to let him get out of the emergency room, but eventually they did admit him to the intensive care unit. And then once he was in the intensive care unit, they wouldn't give him his thyroid medication. They wouldn't give him anything. In the process of transferring him from one part of the hospital to another, he had a catheter and that was traumatized. When I saw him, there was blood pouring out of his catheter and around that, and the doctor was there, and I pleaded with him to just do a blood count. They wouldn't do a blood count. I said they do blood counts in doctors' offices. They do blood counts in ordinary hospitals. This is a sophisticated intensive care unit, children's hospital, and you won't do a blood count. He said it's not indicated. And so why is this so important? It's so important because it's not a matter of stopping an extraordinary treatment. These patients do not get any treatment. The only reason the ventilator was continued is because the court was involved and said they had to continue the ventilator. But at that point, the doctors won't do anything else. They won't do blood counts. They won't do electrolytes. They won't give them any nutrition. And you got to know how awful it is for the mother, the father of these children. They suffer terribly. They see what it is with their children. They go to hospitals thinking that they're going to get good treatment, and they find themselves in that situation. Ari Chakrabarti did die in the intensive care unit in New Jersey after he was declared brain dead in Philadelphia, transferred brain dead to Guatemala, treated, improved, healing. All of that happened over months. And then declared brain dead. And in New Jersey, they would not follow the New Jersey law because they said that in Philadelphia they declared him brain dead, and the legal system in Philadelphia said that he was brain dead, and so the doctors in New Jersey adhered to that and refused to, at least it seems to me, refused to follow the law in New Jersey. Now, I'm going to tell you about another patient, and incidentally, some of you who pay attention to the news might have gotten your news through email and the like about a young man. Where he is, I'm not absolutely sure right now, but who was declared brain dead and then was able to hear them talk about that and respond and that kind of thing. It's in the news. Several people sent it to me and I got it overnight, so it's there. But I'm going to tell you about Zack Dunlap and Zack Dunlap was a 20-year-old young man who was injured on a four-wheeler, and the four-wheeler overturned, and then he was taken to the local hospital and then transferred to the transplant center. The local hospital, I want to say Davidson, but that might not be right, but you'll hear it in a little bit. But the neurosurgeon who took care of him said that his injuries were absolutely catastrophic, and he was unresponsive. And they did a comprehensive brain scan, and then he was pronounced brain dead 36 hours after the injury, and the scan showed no evidence of circulation to the brain. The pictures I'm going to show you in just a minute of the brain scan. Actually, I'm indebted to Dr. Coimbra, who you'll hear from. I'm indebted to Dr. Coimbra for a lot of things, but you'll hear his presentation. And so he might show you the same slides, but if he does, it's because I got them from him a couple of years ago. And why do I use his slides? They were better than mine. They're the same thing, but his slides have nice circles on them and that kind of thing, and it points it out easier for you. And I'm going to show you Zack because when we were planning for this conference, I knew about Zack, and Zack had there was a lot of publicity about Zack 11 years ago. And I had tried twice before to see him, just to follow up with him, but wasn't able to do that. So I thought, well, I'll try one more time. And so I'll show you an interview with Zack. But the way first Zack said yes, he would give me an interview, but he said, only because of this conference and only because of medicine and how it can help other people. He did not do it for publicity or anything else, and you'll see the interview. To do the interview, that day to get there, I was in 4 states. To get the interview, the friars of the Immaculate, Friar Didicus and Friar Cyprian. Friar Didicus was in New York, and I was in Toledo, and we flew to Atlanta and met there, and then flew to Dallas, and then rented a car and drove to Oklahoma to do the interview because and so the interview that you're going to see in just a few minutes, it's the first time it's been shown publicly. Remember that it's a young man who had no evidence of circulation to his brain, and then you'll see that after the injury, he met his wife and is married and has a child, and you'll see his wife and you'll see the child. You'll also see that he's employed. You'll see that his mother is interviewed also. Zack is a true pro-life story because he was adopted he could have been aborted, but he was not aborted. So his life was in jeopardy at that time, but it did not get aborted. And then you see that his life was in jeopardy again when he had no evidence of circulation to his brain and was said to be brain dead. So take my word for it, it gets a little more clear on this one. But you see the dark areas compared to these areas that are more red. It shows no evidence of circulation, and if the lights were dim a little bit, but if we don't see them, it's okay. If Dr. Coimbra shows the slides a little bit later, you'll see them even better then. It's okay. They'll hopefully they'll trust me. There's no evidence of circulation, and then there is evidence of circulation around there, and so here's the interview.
Good morning, Zack.
Good morning, Dr. Paul.
Oh, incidentally,
Thank you very much
those
for
that
granting me
Italian
this
can
time
read
to
the
interview
Italian.
you.
It's no trouble, sir. Thank you for coming.
Last night I met you at the lake where you work.
Yes, sir.
A beautiful lake. Tell me, are there any fish in that lake?
We got big crappie, a little bit of perch. We got walleye, saugeye, alligator gar, and every type of catfish you can imagine.
So when you're there, you're able to help people to enjoy life?
I enjoy helping people with questions they have about the lake, and it's mostly a retirement or family lake, and it's enjoyable whenever you help people find a good place to fish and just enjoy life.
Yes. You were involved with an accident?
Yes, sir. That was November 17th, 2007. And a fun time down on the river kind of ended badly.
Yes. So you were on a four-wheeler?
Yes, sir. I was on my 450R Honda, and we were coming back from the river to my buddy's house, and went around the corner. Of course, didn't have on a helmet, just a lid that I always wore at the time, and it blew off my head. So I turned around to go get it, and at that time, my two buddies that were with me passed me by, and I slowed down, get my cap, and then I went ahead and did my drag race launch. Went through all 5 gears with the front end in the air. And headlight don't do you no good whenever it's pointing up. I saw one of them fly by on my right side. I hit my back brake, slammed the front end down, and there was Colton right in front of me. I cut it, panicked, wasn't nothing I could do. Last I remember is flying through the air sideways, biting the handlebars, and then letting go.
He was my miracle from the very beginning. He is adopted, and he always had such a loving nature. He was just drawn to everyone he could talk to. He was just like his grandfather. He could talk to anyone. He didn't meet a stranger, and he would do anything for anyone. And as he grew up, he had a little bit of an adventurous side to him that I didn't always approve of, such as riding his four-wheeler with no helmet. And he always told me he had his helmet with him. Just wasn't on his head.
Yes.
So he always had lots of friends. He loved children, and they all loved him.
You were instrumental in saving Zack's life.
I don't know about that. I just doing what I felt like I needed to do.
Yes. What was it that you did?
Well, man, I guess it all start kind of right here in Frederick. You know, Frederick is where I worked at the hospital, but I wasn't working that day. My wife got a call from his dad, Zach's dad, Doug, and we were out in the yard, I think, just messing around. The kids were riding their little motorcycles and stuff, and he said, "I need you to come to the hospital. It's really bad. It's Zach, and it's bad." So we got there, and boy, it was bad. You know, seeing Zach in that state, he was almost unrecognizable. There was even some gray matter coming out of his ear. You could see it. A large swelling on the backside of his neck and bottom portion of his head. And we just went right to work on him, you know, getting lines started or using the lines that the paramedics had already started and accessing more, and just doing what we could to get the swelling down as best we could while we had the helicopter en route to come get him and take him to an advanced level of care. I think that was instrumental in his road to recovery, but from then on, it was just it was a pretty grim deal, you know.
That was probably one of the worst times that I will hopefully ever go through.
What year was Zach born?
He was born in 1986.
And of course, that's after 1973 when they legalized abortion. And so Zach's mother had Zach. She did not have an abortion. And so we're grateful to her that she did not do an abortion. And of course, it's possible since 1973 that he could have been aborted, but he wasn't. So he lives on.
I actually got to meet Zach's birth mother, and that was one of the first things that I told her was how thankful I was that she chose to give him life.
Yes.
Because without that, he wouldn't be in my life.
Next thing I remember was laying in the hospital bed, not being able to move, breathe, couldn't do anything, on a ventilator, and I heard someone say, "I'm sorry, he's brain dead, he's passing away." And there's nothing I could do. You could just get mad. I couldn't do anything to assign at all, and just kind of let it go.
Did you want to do anything?
I tried to.
What was that?
Tried to scream, tried to move, and just got extremely angry.
Yes. So it had to be a very painful time for you.
Yes, sir.
While we were there, they had pronounced him brain dead and done everything to prove that was the case. And everything that I could see, now I said what I could see, was telling me and was confirming what they were saying was true. Even up to and including the day that Zach kind of came around. But just had an inward knowing, you know, being a man of faith and being around people of faith, my wife being a believer, and, you know, others believe in God for a miracle, believe in God that it wasn't his time, and trusting in him to lead us through this deal. Really, I think that's all that was done. Now, there were some clinical things that took place that kind of helped to paint the image that we knew in our heart what was to be true, and thank God for that direction to be able to do that. You know, all the way through school, I remember my wife and I would pray that this knowledge that we were receiving was transferred into wisdom, and that we could use it and apply it in our daily lives. And I felt like the Lord really done that for us, you know. So we received the news and on that day, and that morning it really looked, I mean, he was real bradycardic. He wasn't breathing. The ventilator was doing all the breaths. He had 14 per minute. Just with the ventilator doing what it was doing, there wasn't any additional breaths that he was taking on that morning. Pulse was low. Blood pressure was low. But you know, through that day, we just could not accept. I couldn't accept. My wife couldn't accept. And others that were around felt the same way. I remember talking to Doug, and Doug said, Dan, if Zack comes out of this, is he just gonna be a vegetable? And I said, no, I don't think so. I'm not believing that. I'm believing that when he comes out of this, not if, when he comes out of this, I believe he'll restore. I think God's gonna bless this deal. And just couldn't accept anything less, you know. And I remember that morning and knowing what was going on, that the organ liaison was meeting with the family and they were making final arrangements and things of that nature. And I respected that because that was his wishes. But I just wasn't quite sure that it was that time. And I knew in my heart that I didn't feel like the Lord was letting me think that it was Zack's time. And as far as I can tell, he's got control over all this, not us clinicians. And so I remember in the hallway, my wife and I were together. And it was an area that was close to where they were working on Zack in the ICU. But it was an area they were doing some remodeling. It was kind of dimly lit and dark. And I just remember feeling, my wife too, that we just needed to pray. I remember us hitting our knees right in that hallway. I remember the cold floor and, you know, just the hospital environment that we're used to. But we had that area where we could get together and just call out to God. And this was, I think the organ transplant team was already en route to that hospital. And I just remember us praying, God, we need some direction in this deal. Because everything we're seeing is telling us and indicating that this is the appropriate maneuver. But what we knew in our heart was not confirming with what we were seeing with our eyes, that it was not his time. And I'm there just like I am today. I don't look like a nurse. I don't look like a nurse today, but that day I didn't either. You know, I was in my regular clothes that you just always wear. Now, if I'd have been in scrubs, maybe they'd have listened a little bit different, you know. But I remember going back into that room and other family members were there and were concerned. And I remember asking, I told my wife, I said, I just got to go ask, are they going to give him a chance to breathe? Because through that time, after we prayed, I went back in there and Doc, you could see that his blood pressure had changed, that his heart rhythm had changed. And at that time, you know, when we felt so strong to pray, it was shortly after that, I had a chance to be in that room by myself, and I noticed some things looked different on the monitors. I knew it looked different. He had a bigger, stronger pulse, and he was breathing over the respirator. You know, the ventilator was breathing 12 to 14, and Zack was having 16, 18 breaths. And I knew that was him. And those are just confirmations to me, but how can I communicate it to these people that are so educated, and they just see me as a hick? I'm in there in a button-up shirt, and I don't look like a nurse, you know, and I was in RN school. I had only been an LPN for a few months at the time. How could we get them to listen? And, well, as the situation would have it, it was just not very long before the team was scheduled to be there, and there were quite a few clinicians, nurses, and lab techs, and different folks that were in the room. And the organ donation liaison was there, the facility, the local representative, if you will. And I remember asking, and about that time, Zack's uncle was in there as well. I remember asking, are you guys going to give him a chance to breathe before you start operating on him? And she was doing her job. I think based on all the knowledge and the training that she had, I think she'd done a great job. Because I've seen people that are concerned before, and I've seen families that aren't quite educated on the issue and clinging to every hope, but maybe even if it's a false hope at the time. And I can understand dealing and having to be diplomatic in that situation. I did that kind of stuff for a living myself, but I was on the other side this time. And I remember asking, are you guys going to give him a chance to breathe? Are you going to pull the ventilator and give him a chance to breathe before you do any operations? And she couldn't really confirm or deny that, you know. Pretty generic answer. I said, have you guys done any tests on him? Have you done any more tests? And of course she said, yes, we've done all kinds of tests. And I remember back into training and the Lord prompting, that every bit of this to me was like I felt almost like, I don't know how to explain it. I don't want to act like I was possessed because of what, but I was having direction. I was receiving direction at the time. I believe the Holy Spirit was giving me guidance to ask these questions. And I said, have you checked his Babinskis? And of course, I didn't have an ink pen with me. You know, I didn't have a reflex hammer for sure. And they were going to offer one up. So that's when I pulled my pocket knife out. I didn't open it up. Lots of the stories say that I scraped the blade of my pocket knife on his foot. I didn't do that. I just needed something sturdy. You know, Zach's a big old boy. My thumb, pretty strong, but I mean, Zach's a big kid, you know, at the time. And I was going to need some kind of instrument to check that. Well, I remember checking his Babinskis on his, it would have been his right foot. So I checked it, you know, well, they teach us, I guess, in brain death class that if the toes fan, then we just have brainstem activity. But he jerked his foot plumb out of my hand. I remember that. And that was a confirmation to me, like, yeah, you know, man, it's happening. They're going to see it. They're going to see it. Well, then it was rebutted by, well, they teach us in brain death class that could be just a brainstem type activity. It's not coordinated movement. It's more reflex than anything. I said, well, have you checked his pupils? When's the last time you checked his pupils? Give me a light. And by this time, they're a little more accommodating because I think some people on the team were starting to see, man, there might be something to this one. And I so appreciate that compassion that they took. Yeah, they were on the track. The decision had been made. They were going to harvest him. Everybody was on board with that. But a few of them, I believe, were starting to see things a different way. And I'm so thankful for clinicians that have compassion like that. But they still have to check the boxes and dot the I's and cross the T's because, I mean, that's what we have to do in the medical field. And so I said, do you have a pen light? Because I didn't have a light. I wasn't there working as a nurse. I didn't have a stethoscope or anything like that. So they got me a light and handed it to me, and they were checking. I said, no. I said, dim the lights in here. Turn that light off over his head. Let's see if these pupils respond. So they let me in there, and I actually put my hands over Zach's face like that so it could be good and dark. Because, man, if there was a shred of a possibility that those pupils would respond, I might be able to get somebody to listen. And I knew what I had going on in my heart. I knew what my wife had going on in her heart, that it was not his time. And sure enough, I opened one of his eyes, the one on the opposite side where the big injury was. I was trying to be slick, Doc. I wanted them to, you know, if there was any other trauma there, I wanted to check the eye that was furthest away from the injury. Just clinging, trying to get them to see because I just knew. And we checked that eye, and sure enough, it closed up. That pupil responded, dilated. It was dilated and constricted real good. And so I said, y'all seen that, didn't you? Did y'all see that? And one of them was kind of like this, and the other ones, they were kind of denying it, but one of them seen it, I remember. I don't know who she was. And she said, well, sir, they teach us that could also be a reflex response. I said, what do you need to see? She said, they teach us in brain death class that unless the person can have coordinated movement, such as moving an appendage across the midline of the body. And I didn't know what to do. And I said, have you checked his pain receptors? And these are all little bitty, nothing against any female. I work with females every day. But Zach's a great big dude. He's got tree trunks for fingers, and they were using their little pins and pressing on his finger. It probably felt more like a massage to him, you know. And even when I tried to use my pin on his fingernail to get him to move, it didn't work. So I just jabbed my fingernail up underneath his. You know, that's pretty sensitive area right there. And boy, when I did, he reached across here. And I mean, I'm grinning ear to ear because I know now, you know. And while he was over here, there was a lady over here, I think she was doing some final typing and crossing. She was gathering some specimens from his pick line. And he grabbed her hand and then threw his leg off the bed and began to sit up. And about that time, I started shouting orders, you know, that we needed some propofol in here and get him calmed back down. You don't want that swelling to get, because I was watching his intracranial pressure. It was increasing, and we didn't want that right then. But at least we had this, and I kept asking. I said, can I please talk to the doctor? Through all these questions, I was asking, can I please talk to the doctor? Well, when he reached over and grabbed that woman's hand, she said, I'm going to get the doctor on the phone. I said, I believe that's a good idea. And sure enough, things turned around from there, and Zach's here today. And I'm so thankful. I'm so thankful that God would use just regular folks, you know. And I'm thankful that he lined things out in that room to get people to look, because he knew what they were thinking. You know, them people were blessed along their path of learning just like I am, and nothing was wrong by anything they was doing, I don't think. But based on the knowledge that they had, you know, which is a great amount, I think that they're very highly skilled, trained people. But the one that made that system was communicating with us. The one that designed Zack, before his mama even knew him, was giving us the direction. And I'm so thankful for that.
Dan, he was certainly instrumental at keeping them continuing to treat Zack, would you say?
Very. I believe that God just gave him the ability to know what to do, know that something was not right, that Zack wasn't actually ready to go.
Yes.
And if it hadn't been for that, then I don't want to think about what.
Yes. Did they tell you that Zack was brain dead?
Yes, they said that he had no blood flow to his brain at all. They showed us an image of his brain, and it was totally black. Not just part of it, but the entire image was black. And they just said that he had absolutely no blood flowing to his brain, and that he wouldn't recover from it. It was news that no one but no parent wants to hear.
Did they tell you to tell him goodbye?
Yes, they did. They told us to gather anyone that wanted to see him in so that they could say their goodbyes to him.
Yes. So, Vanessa, you didn't know Zack at the time of the accident, did you?
No, sir. No, sir. I just knew his mom because she taught me in the 3rd grade.
Yes. Mm-hmm. So
I met Zack a year later after his accident.
Yes. So it was very close to their taking Zack's organs. And if they would have done that, you wouldn't have Zack, would you?
No, I wouldn't have my Harley and Zack's family. So I've gained a lot marrying Zack.
Yes. So Zack is special, and obviously you have a family, Zack and you and Harley, a wonderful family, and of course, I told you a few minutes ago that you were beautiful, and
Yep.
I guess your dad tells you that too, doesn't he?
Yeah.
Yes.
And my mom.
And your mom, sure. They love you a lot, don't they? You love them. Yes. So Zack is a very special person.
Yes, he is.
Yes, and of course his life continues on because of God and his cousin, who did one more thing to get some response. So they did not take his organs.
Yes,
They
sir.
would have taken his organs, we wouldn't be here talking, would we?
You're right.
Yes. So, are you an organ donor?
Yes, I am.
Yes. Would you like to reconsider that now?
Probably so. Yes, sir.
Yes.
It makes sense.
Yes. Makes sense not to be an organ donor because every organ that's transplanted is taken from a living person. There are no organs you can get from a cadaver.
Yes, sir.
You can get some tissues, but that differs from organs. Every organ that's transplanted comes from a living person. And then the living person either is no longer on earth or not the same as the person was before. Do you have any advice or thoughts to other people, relatives, who might find their relative unconscious and on a ventilator?
Spend time with them, pray with them, and encourage them.
And not give up.
Yes, sir.
Some other people that are unconscious on a ventilator end up having their organs taken, you were very close to that, weren't you?
Yes, sir.
And your cousin, who's a nurse, did another test and got some response, and that stopped them from taking your organs.
Yes, sir. If it wasn't for him going the extra steps to try and prove, then my heart, liver, and lungs would be in somebody else. And there ain't a guarantee that they work for them.
Thank you very much.
Thank you.
This is from Zach's chart. It says patient is brain dead, perfusion study compatible with brain death. Those are photographs that I took from his chart and put there. I hope you were able to hear that okay. And then I hope those who use Italian could get sufficient words to understand it. That Zach had a cousin who was a nurse. It helps to have somebody in the medical field when you have serious illness. He wasn't working and practicing in that hospital, at that transplant hospital, but he was there as a cousin. And the significant thing is that he cared. The significant thing is he did one more test, the test with the pocket knife. The pocket knife was closed. It was just the blunt end that he got the response. And then you heard things like purposeful movements and cross to the other side. You see the movements on Takisha, they say that doesn't count. And they only pay attention to purposeful movements. And then you heard in Dr. Zabiega's presentation in terms of when they first did these things, they had to have no movement in Moulier and Goulon when they first started, the Harvard criteria, no movement. And then the antidiuretic hormone that is often there functioning, indicating that the brain is functioning, but they don't count that. Between 1968, when the first set of criteria was published, the Harvard criteria, in 1978, there were 30 disparate sets of criteria. Each set of criteria becomes less strict. So then what happens? We get to Aiden Hulu, and Aiden Hulu is a 20-year-old college student in Nevada who develops abdominal pain and goes to the emergency room. She's in one part of the state, her family's in another part of the state, goes to the emergency room, and there they did a CAT scan. Didn't find anything on the CAT scan, but decided to do exploratory laparotomy and to look for appendicitis, although they had none pre-op, or to look for anything. So exploratory laparotomy, and at the end of the procedure, they were done with the procedure, her blood pressure went down, and she had to be resuscitated, and then they said that she had lack of oxygen, and in a few days they were saying that she was brain dead. And so the doctors there said she was brain dead. We got involved with the court. I went to the court and testified, and she had brainwave activity. They did 2, maybe 3 brainwave tests, all showed activity. She never had a flat brainwave, and so we then appealed it to the Supreme Court in Nevada, and the Supreme Court ruled 7-0, 7-0. I never heard of a Supreme Court being. I'm sure it happens sometimes, but all 7 Supreme Court judges ruled that they did not fulfill the criteria for the state of Nevada. Nevada, and they weren't sure about the Academy of Neurology, so they referred it back to the lower court. And so Aiden Hulu, they would not do tracheostomy, they would not do feeding tube, they wouldn't give her thyroid medication, and she lived many months. It was in April when this started, and she died the later December. Remember that stuff, those things you heard, that how they have cardiorespiratory arrest quickly, 2-3 days? That's really not so. That's because of not getting good treatment. But she didn't get good treatment, and they wouldn't do anything to get her out of the hospital. But then what happened was that the legislature got involved in Nevada and changed the law in the state of Nevada, saying now instead of any one of those 30 or more disparate sets of criteria, it had to be the Academy of Neurology criteria that had to be followed. Furthermore, they said to do the apnea test, and you'll hear more about that, the procedure of the apnea test as we go along. To do that test, the neurologists do not have to get permission from anybody. They can just do it without permission. Furthermore, that once they have this declaration of brain death, they are no longer looked at as a living person, but as a container of organs. And if the relatives want treatment to continue, they might have to pay for all of the expenses. So they make it so that you cannot complain or speak up for your loved one. They may put it into the law. That's in the law in the state of Nevada as a result of what we did to get her case to the Supreme Court in Nevada. Well, I have to stick to time, and my time, and here comes John Henry. I'm sure he has an announcement or two, and thank you very much.